The coronavirus pandemic continues to wreak havoc globally. The current global COVID-19 disease situation is as follows. 3,018,952 have tested positive for the virus. Out of these, 207,973 have died. In Africa, the confirmed cases stand at 23,254 and fatalities are 903. These numbers continue to rise and there is no indication when this will stop. It is therefore of utmost importance that we strictly observe the measures of the Ministry of Health, the measures that the Ministry of Health has been advocating. Simple as they may sound, experience has shown that they are most effective. These measures include hand washing, maintaining social distancing, wearing of face masks, quarantine, and basic hygiene. I want to thank our people who have observed these measures. The gains so far achieved that have made it possible for the gradual opening of the economy is owed to their support. I want to urge them to continue with the practice. In the same token, I must say that we have noted with dismay the casual attitude with which some of our people are not observing these measures. We have observed that some eateries are not only operating without any regard to social distancing requirement, but also deep into curfew hours. The transport sector, particularly Matatus and Bodaboda operators, have also gone back to the old normal ways. There is public outcry that some hoteliers are unfortunately not observing the protocols we have established. The government will assess and determine whether these measures can continue or need to be reviewed if need be. My appeal, therefore, to hoteliers, transport industry, and everyone else is to abide by the containment measures already highlighted. If we do not, the spread of this disease will be extensive and will be very difficult to contain. We have also observed that some mosques have revised prayer time and are now opening for prayers at night. I must warn such religious leaders that this contravenes the directive that suspended all religious gatherings. They must stop this practice forthwith, failure of which legal action in accordance with the public health shall be taken against them. Fellow Kenyans, I informed you about the targeted testing as a measure to control the spread of the disease. The exercise has already kicked off in the identified high-risk areas. This has to continue for purposes of containment of infection. The outcome of the testing exercise so far has shown a low turnout in some of these areas. In the last 2 days, the testing teams have tested 803 against a target of 2,000 in Kawangware, 494 in Isli against a target of 3,000. I want to remind Kenyans that there are countries where people beg to be tested, yet their governments are unable to do so. As of now, the Ministry of Health has acquired the testing capacity to undertake targeted testing, but the willingness of the people to be tested is low. I want to appeal to Kenyans to willingly come forward to be tested. If we have to flatten the curve and reduce infections and minimize the risk of transmission, the Ministry of Health is encouraging Kenyans in the target areas to present themselves to the testing teams. Experience has shown that countries that have managed to flatten their infection curve quickly, have heavily relied on targeted testing. The tests, of course, will be conducted free of charge. I want to remind Kenyans that as we continue to address COVID-19 pandemic, the other health services must continue to be provided to Kenyans. In this regard, I call upon all Kenyans to continue accessing health services in their preferred facilities. We are aware that Kenyans may be keeping away from utilizing health facilities for fear of contracting COVID-19 from our facilities. I want to assure Kenyans that we are taking every necessary precaution to ensure that those who visit health facilities do not stand a risk of acquiring the disease from those facilities. Our records are indicating low hospital visitation for health services. Let us all be reminded that this kind of health-seeking behavior can lead to other more serious consequences. In the same vein, counties and other health providers are requested to continue providing health services to Kenyans. Yes, COVID is in our midst, COVID-19 is a pandemic. We are focusing on battling it, but we also have other services to deliver. Regarding quarantine, there has been extensive debate on the status of those arrested for breaking curfew rules. I wish to state that such individuals will no longer be accommodated at the usual government quarantine facilities. Instead, the Inspector General of Police has been directed by the National Emergency Response Committee to designate a curfew breakers holding place. The place must be able to meet the social distancing requirement.